You are, for me, the #1 European healthcare digital business.
That's
and you're
true.
from Poland.
Yeah.
You have rushed very, very fast to close an exciting deal for you last night to be able to announce it today.
Yeah.
Mariusz, I'm very pleased to have you here. You are only Polish company, but you're one of the biggest. Thank you so much.
Proud of it. Thank you. So I'm Mariusz. I'm a founder and CEO of DocPlanner. We are the marketplace for patients searching for doctors. OK. First, I'm going to tell a few words about the market in general. So we believe that efficient access to doctors and healthcare should mean that we should all be able to find a good doctor that is not far away from us very quickly. So if we need a dermatologist today, we should be able to find one, good one. We shouldn't be waiting. We shouldn't be waiting. If face-to-face meeting is not necessary, we should be able to have a video consultation or a chat with a doctor. For instance, if we have a kid, then sometimes traveling might be an issue. And we should always have instant access to our healthcare data. Instant access. I believe this is the reality. So it's a little bit more complicated. There are no good platforms in most of the countries that you can go to and find a good doctor. It's impossible. So I guess if you needed a good dermatologist for today, then it wouldn't be so easy to find the one within the radius of 3 kilometers. Most likely you would go to Google, you would search, then you would start calling, and it would be pain in the ass. In a lot of cases, you would have to wait. Only a fraction of doctors, we have 21st century, but only a fraction of doctors let their patients have a video consultation with them or have a chat with them. And I assume most of you don't have access to your healthcare data. And it's crucial. It's about our health, and we still don't have it. Right? So the healthcare market is strongly underdeveloped in comparison to different markets, like hotel market or restaurant markets. Why? There are some barriers. The market is highly regulated. It's not a homogeneous market like in a hotel market. There is a lot of money in the market, so a lot of companies noticed it 10, 15, 20 years ago and implemented software that now it's extremely difficult to integrate it with. So it's like natural barrier for newcomers that are trying to disrupt the market. These big players obviously are resistant to change, and as a result, most of the companies in healthcare fail or stay small. I met a lot of companies 3, 4, 5 years ago that wanted to bring a lot of good, in my opinion, good innovation to the market. And when I talk to them now or a year ago, most of them are super small, even though the product was there. So the barrier for entering healthcare market, in my opinion, is a little bit higher than in other sectors. We want to fix it. We want to change it. We want to make healthcare accessible. And what's the master plan for doing that? Why we think we are different? Well, we think that to be able to have an impact on a healthcare market, you need to have a power over patients. You need to have a lot of patients that you can use as a leverage to negotiate with big players in the market. So our master plan assumes that we win patients, then we convince doctors to start using our software, and once we have this connection, and only once we have this connection, we start fixing the market use case by use case. You can think about us as a SaaS-driven marketplace. So I don't think it's possible to disrupt this market without doing software for doctors. I don't think it's possible to disrupt this market without having very strong marketplace. So on a marketplace side, we are pretty similar to Booking.com or Airbnb. On the doctor side, we are giving easy software to doctors that they can use to manage their private practice, both on desktop and mobile version. But it has to be there. How are we doing? Is the strategy efficient or not? So currently, we have 15 million patients visiting the marketplace every month. We already convinced almost 20,000 doctors to start using our platform. We have 2 million verified opinions about doctors. So this is a huge incentive for patients to come to the platform and search for doctors. And last month, we booked more than 200,000 consultations. So it's working. This is a chart describing number of doctors that are using our software. So the software adoption. As you see, we are accelerating. So once you cross barrier, the decent scale, you start to accelerate. But you need to have a lot of patience to be able to do that. This is the table showing the biggest marketplaces for patients worldwide. So in terms of patient traffic, because now I'm showing to you patient traffic, we are the biggest one. We have ZocDoc in the United States. We have Doctoralia. We have Yamida, Practo, and Doctolib, very good companies, by the way. Today, I'd like to announce that we are merging with the third player, with Doctoralia, and we are forming one player that has access to 15 million patients monthly, and we are increasing the gap in patient traffic between us and other players. So in terms of patient traffic, by far, we are the biggest one at this point. These are the markets that we are market leader in. Brazil, Turkey, Poland, Spain, Mexico, Italy, Argentina, Chile, Czech Republic. Because you need to meet doctors to be able to convince them to start using your software, especially good doctors, we need to have a local presence. So currently we have offices in Rome, Barcelona, Istanbul, Warsaw. We are opening offices in Mexico City and Rio de Janeiro, because only then we can deliver supply to our marketplace and create a good experience and give good product for our patients. We have 250 people currently, and within the next 12 months, we're going to add another 100 people to be able to convince massive amount of doctors to join our platform. This is an important number about our market. So in our key markets, we have a very strong position. For instance, in Mexico, the player number 2 is like 25 times smaller than us. But even though we have only 2% of our addressable market, so 2% of private doctors working in a private sector. So what I'm trying to say is that digital revolution in a healthcare market in this sector haven't even started. We are at the beginning. Only in Europe, there are 4 billion consultations annually. 4 billion. Less than 1% are done online. No video consultation, no chat with doctors. I mean, there are a lot of companies trying to disrupt this market, but on a scale, we can assume there is still no that kind of service. And as a result, the experience on a patient side, in my opinion, is still weak, right? We want to lead this innovation, we want to lead this change, and we want to fix the healthcare market. Thank you.
Okay, Marcus, bitte.